Hello, gentlemen and ladies, I am Dr. Jenny. Today, I will bring you the Health in the Elderly segment with practical guidance that will provide useful and helpful information to help you maintain good health and live happily and healthily every day. In this video, I, Dr. Jenny, will share in-depth knowledge about common health issues faced by older adults, along with advice on nutrition, lifestyle, and disease prevention measures. Join me as we explore effective health care methods to help you live a healthy and happy life. During the golden years, stay tuned to receive valuable and scientific advice from me, Dr. Jenny, who is always by your side in your health care journey. Osteoporosis in the elderly, a common health condition. Osteoporosis is a common condition among the elderly, ranking just behind cardiovascular diseases. Currently, about 1/3 of women and 1/8 of men over the age of 50 are at risk for developing osteoporosis. 1. Overview of osteoporosis. Osteoporosis, also known as brittle or porous bone disease, is a condition where bones gradually become thinner, and their mineral density decreases, making them more fragile and prone to fractures even from minor injuries. Osteoporosis is the leading cause of fractures in postmenopausal women and the elderly. Bone fractures due to osteoporosis can occur in any bone, though they are most commonly seen in the spine, femur, and wrists. Some fractures, particularly in the spine and femur, may not heal properly and often require costly surgeries. Osteoporosis is a silent disease. Patients may only experience vague symptoms like body aches, height loss, or spinal deformities, which often go unnoticed until a fracture occurs. As individuals age, bone density becomes insufficient to maintain bone strength compared to when they were younger. Quiz. What causes osteoporosis? Osteoporosis is one of the most common bone and joint diseases today, and its prevalence is rising. It is more common in older adults, particularly women. What are the causes of osteoporosis, and who is most at risk? 2. Causes of osteoporosis. Bones require minerals like calcium and phosphate to form properly. If the body does not get enough calcium from food, bone formation may be affected. Bone is constantly being renewed, with new bone replacing old bone. In youth, the body forms new bone faster than it breaks down old bone, leading to increased bone mass. Most people reach their peak bone mass around age 20. As people age, the breakdown of bone tissue surpasses the formation of new bone, leading to osteoporosis. Key causes of osteoporosis include unhealthy lifestyle and lack of exercise, heavy labor and frequent lifting of heavy objects, a diet low in calcium. Gender. Women are more likely to develop osteoporosis than men. Insufficient calcium intake in youth. This leads to a decrease in bone formation and an increase in bone breakdown as one ages, weakening the bones and making them more prone to fractures. 3. Symptoms of osteoporosis. The condition of bone loss or reduced bone density due to osteoporosis usually does not show clear symptoms. A person may not know they have osteoporosis until the bones become so weak that fractures occur after a minor impact such as twisting an ankle, bumping into something, or falling. Decreased bone density may lead to spinal compression fractures, which manifest as acute back pain, height loss, and a hunched posture. Common symptoms include pain in the bones. The most noticeable symptom of osteoporosis is pain in the long bones. This can feel like a deep, aching pain or even a stabbing sensation in the bones. Pain in weight-bearing areas such as the spine, lower back, pelvis, hips, and knees, often recurring after minor injuries. This pain is typically dull and prolonged, worsening with movement and relieved by rest. Pain in the spine and lower back. These pains may also affect the intercostal nerves, thigh nerves, and sciatic nerves, making movement difficult and causing discomfort during activities like bending or turning. For middle-aged individuals, osteoporosis may coexist with other conditions such as varicose veins, joint degeneration, and hypertension. 4. At-risk groups for osteoporosis. Several risk factors contribute to the development of osteoporosis. Some are modifiable, while others are not. Non-modifiable risk factors include gender. Women, especially postmenopausal women, are at a much higher risk of osteoporosis due to lower bone mass. Age. The risk of osteoporosis increases with age. Body size. Small, thin women are more likely to develop osteoporosis. Family history. A history of osteoporosis or hip fractures in the family increases risk. Early menopause before 45 years of age. Previous fractures. Other medical conditions, such as endocrine diseases, rheumatoid arthritis, kidney disease, or Cushing's syndrome. Caucasian or Asian descent. Modifiable risk factors include sex hormones. Low estrogen levels during menopause or testosterone deficiency in men can lead to osteoporosis. Poor diet. Low calcium and vitamin D intake increases osteoporosis risk. Anorexia. Eating disorders can lead to bone loss. Long-term use of certain medications, such as corticosteroids or heparin. Physical inactivity. Lack of exercise or prolonged bed rest can weaken bones. Smoking. Smoking damages bones as well as the heart and lungs. Excessive alcohol consumption. Drinking too much alcohol weakens bones and increases fracture risk. 5. Preventing osteoporosis. There are several preventive measures to slow down bone loss and reduce the risk of fractures, although they may not cure the condition. Ensure adequate calcium intake. Consume calcium-rich foods or supplements. For adults, 1,000 milligrams per day for individuals aged 19 to 50 years. 1,000 milligrams per day for men over 50. 1,200 milligrams per day for women over 50 and men over 70. Sources of calcium include dairy products, calcium-fortified juices, beans, fish, and leafy green vegetables. Regular bone density tests. Check bone health regularly. Follow medical advice. Take prescribed medications as directed and avoid self-medicating. Exercise. Engage in weight-bearing and muscle-strengthening exercises as recommended by a healthcare provider. Avoid smoking and limit alcohol consumption. Prevent falls. Implement fall prevention strategies at home. 6. Diagnosing osteoporosis. Diagnosis can involve bone density tests. Dual energy X-ray absorptiometry (DEXA) is the most common test for measuring bone density. It is non-invasive and takes only a few minutes to assess the amount of bone loss. Blood and urine tests, to check for hormonal imbalances or deficiencies in vitamins and minerals. 7. Treating osteoporosis. Treatment may include calcium and vitamin D supplementation. For individuals aged 1 to 70, 600 IU of vitamin D daily, and for those 71 and older, 800 IU daily. Maintain a healthy weight, neither overweight nor underweight. Regular physical activity. Engage in walking, jogging, dancing, and aerobic exercise for at least 3 to 4 hours per week. Quit smoking. Limit alcohol and caffeine consumption. Review medications. Consult a doctor about medications that may affect bone density. Hormone therapy. For women in menopause or those who have had their ovaries removed, hormone therapy may be considered after discussing risks and benefits with a doctor. Medication for osteoporosis. In some cases, medication to prevent bone loss may be necessary. Changes in lifestyle such as quitting smoking and reducing alcohol intake, along with regular exercise, are key components of managing osteoporosis. However, care should be taken to avoid overexertion to prevent fractures. We cannot stop aging, but we can control how our body responds to it. Osteoporosis is a condition that can be prevented and managed if you live a healthy lifestyle. Maintain a balanced diet, exercise regularly, avoid bad habits like smoking and drinking, and monitor your bone health regularly. Don't forget to consult your doctor for appropriate treatment methods. Bone health is the foundation for a healthy life, so take care of your bones today for a stronger future. Thank you, gentlemen and ladies, for taking the time to watch today's video. Maintaining health in older age is an important journey that requires special care and attention. I hope the information and advice I shared will provide you with useful knowledge to maintain your health, live joyfully, and enjoy the golden years of your life. Once again, I sincerely thank you for your attention. Wishing you all good health and happiness. Please subscribe to the channel to motivate me to create more informative videos on health care. See you in the next videos.